Welcome back. In a previous video we talked about the symptoms of Down syndrome, and here we'll talk about the complications, which are more severe but less common. Most of these complications don't appear or don't become prominent until the patient becomes older. Keep in mind they are more severe, but they're a lot rarer. Starting with heart defects, and around half of patients with Down syndrome are born with some congenital heart defects. The most common, of course, being ventricular septal defect. Some of these heart defects will require surgery early in life. The second type is gastrointestinal defects. These complications range all the way from digestive problems to gastroesophageal reflexes and celiac disease. Next, we have immunological disorders, and these patients are more likely to have either overfunctioning immunity, developing an autoimmune disorder, or underfunctioning, developing many infections. Next is sleep apnea, and it occurs because of the soft tissues in the skeletal muscles, especially around the airway, and this can cause obstruction during sleep. Next is obesity, and this is not very well understood, but Down syndrome patients are more likely to be obese than the general population. Next is vertebral and spinal problems, and the most common is atlantoaxial instability, which is basically misalignment in the first two vertebrae. This puts the patient at a greater risk of vertebral fracture or spinal cord injury, especially in hyperextension of the neck. So during the intubation process, we do not hyperextend the neck as we normally would for any other patient. Unacademy is the largest Indian teaching platform. They have a variety of interesting topics and courses, and recently they have extended their courses to include topics for the USMLE and the Step 1 exam. The USMLE course checks all the important marks, including recognized names like Dr. Najib and Dr. Raj, and of course many other skilled teachers. It has more than 800 recorded lectures and comprehensive videos. Unlike all good courses, they also have their own Q bank with more than 3,000 questions and 300 review videos. For a limited time only, the course will have 75% discount with an additional 10% discount if you use my coupon AMAD10. Once you purchase the course once, you will have free access for a full year. Next is leukemia, and these patients of course have higher chance of leukemia compared to the general population. We have several theories, but we're not very sure about the cause. Next is dementia and Alzheimer's disease. For some reason, patients with Down syndrome are significantly more likely to develop Alzheimer's at around the age of 50. It is very important for patients with Down syndrome to have routine medical care, so we can anticipate and expect these symptoms and complications to occur before they do occur, and early management is often very good and sometimes curative. When it comes to life expectancy, nowadays we have a very good medical care, and we expect a patient with Down syndrome to live up to 60 years old or sometimes more than 60 years old. Alright guys, that's all I have. Thank you so much for watching, and hopefully this cleared things out.